Our talk today is Understanding Alzheimer's and Dementia. Our speaker is Dennis Fisher. Dennis, you want to take it away?
Certainly. Thank you, Amy. Well, good afternoon, everybody. Welcome to Understanding Alzheimer's and Dementia, our program brought to you by the Alzheimers Association, our local one here in Cleveland. She said, my name's Dennis Fisher. I'm a volunteer who does programs like this. Normally, I would be at your library or some library community center doing the presentation, but we're still doing it by Zoom. Also, sometimes I use the word caregiver, care partner. They're sort of synonymous. Like care partner is a little bit better, I think, for people who have dementia in the early stages, and they've got somebody who's they're very close with and working with and understands what's going on. Later, it becomes more of a caregiver situation. So, but those terms kind of get used interchangeably. I'm not sure why everybody attends. Hopefully, you're just trying to get a general, better understanding of this disease and dementia in general, which is what we're going to talk about. Maybe you have something that's touched you personally, and you just want to learn more too. So, with that all said, we'll get started with this presentation. We're going to start off just kind of giving you a few of our learning objectives for today. We're going to compare Alzheimer's and dementia. We're going to recognize how Alzheimer's disease affects our brain. We'll talk about risk factors for this disease. We'll identify stages, 3 of them, of the disease. And we'll talk about current FDA-approved treatments that can address some of the symptoms of the disease. And very briefly, of course, you may be aware, there's some new news in that area. Describe how scientists are working to advance the research for dementia and Alzheimer's, and also look at a few of the resources that are available to you through the Alzheimers Association. We start off sometimes in this presentation, we as part of doing the presentation, we ask you questions. So that's what we're going to do. We call it test your knowledge. We don't keep track of this or anything, but we just like this. Again, it's a way of giving the information. How many Americans do you think are currently living with Alzheimer's? We go from 850,000 all the way up to 3.4 million. Well, I asked some of my family members about this, and they made a stab at it, and they said 3.4 million, but they were wrong. So you get a second try. 5.8 million Americans live with Alzheimer's currently. At the current rate that people are getting this disease by 2050, in 30 years, this number is projected to be 14 million. So hopefully research and efforts between now and then will make that number not be nearly as large. We got another question for you. Of course, as we talked about, there's caregivers that are involved with patients. How many unpaid Alzheimer's caregivers are there in the United States? Once again, you have a variety of numbers. We know how many patients there are, 5.7 million, 5.8 million people. So you might guess, wow, there's got to be a lot of people to take care of them. And there is 16 million plus. These are unpaid people. So it impacts more than the people who have the disease. 80% of these caregivers are it's provided at home by family members. Half of them have to go into work late, have to take time off. Some of them have to quit their jobs entirely in order to take care of their loved ones. And they give about, I think it was 18.5 billion, that's with a B, billion hours of effort to take care of these people. That was from last year. So again, as you see, it takes a tremendous toll on many many people. There's more information out there. We can go through a thing called Know the Facts. I don't know if you're surprised by those numbers or not surprised by those numbers, but many people who have no connection with Alzheimer's are very surprised by those kind of numbers. We think and often hear that the name Alzheimer's and dementia, and they get used interchangeably. We're going to discuss both of those, Alzheimer's and dementia, and sort of how they're related. But once again, we're just going to test your knowledge. This one's maybe easier because it's true and false. You have a 50% chance. Alzheimer's is a normal part of our aging process. I think that's true or false. It's false. It's a brain disease. It causes problems with your memory, thinking, behavior. It's not a normal part of our aging. People younger than 65 can get Alzheimer's. True or false? Unfortunately, that one's true. There's 200,000 Americans under the age of 65 who live with this disease called younger onset. Some individuals can develop it in their 40s or 50s. So it is not a specific age that where you get Alzheimer's, but generally people are older. We're going to hear from a number of experts today, some physicians, doctors, people who are in the field in various capacities. And as we hear from them, we'll share their knowledge and their expertise.
Dementia is the umbrella term for an individual's changes in memory, thinking, or reasoning. There are many possible causes of dementia, and Alzheimer's is the most common cause. Other causes of dementia are vascular dementia, which is marked by changes in the blood flow in the blood vessels in the brain. Dementia with Lewy bodies, identified by specific brain changes throughout the brain that include the buildup of a protein known as alpha-synuclein. And frontal temporal dementia, which is marked by brain cell loss in the front sections of the brain or the frontal lobe. Each type of dementia may have distinct characteristics to cause specific behaviors in the individual, but there is also some overlap in behaviors among the types of dementia.
So, Dr. Snyder's gave you that general explanation of how this dementia is an umbrella term, and there's other dimensions too. Each one has a different cause, as she said, and different symptoms. And there's a number of dementias. We can look at some of them real quickly here. These are all different types of dementias. Alzheimer's is the largest category, but sometimes you hear a lot about frontal temporal dementia and Huntington's disease and dementia with Lewy bodies or Parkinson's disease dementia. So there are a number of different things. We're going to go also now and hear from a caregiver, which we will hear from now and then. Alzheimer's and dementia, it's just a quick recap here, I'm sorry. Dementia is a general term for a collection of symptoms that are severe enough to interfere with your daily life. It's the most common cause of dementia. It's not a normal part of aging. It's a progressive brain disease. We need to remember that. So let's talk a little bit about Alzheimer's and the brain, since it's a brain disease. This is a very complex organ, our most powerful organ, although it's only about 3 pounds of our body weight. It's very important. Let's hear from another expert, Dr. Hartley.
More than 100 years ago, Dr. Alice Alzheimer's described specific changes in the brain, what we call the formation of plaques and tangles. Now, Alzheimer's is a progressive brain disease that's marked by these key changes and is thought to impact memory, thinking, and behavior. The brain has 3 main parts: the cerebrum, the cerebellum, and the brainstem. Each one plays a role in how the body functions. The cerebrum fills up most of your skull. It is part of the brain most involved in remembering, problem solving, thinking, and even feelings. There are about 100 billion nerve cells or neurons throughout the brain that transmit messages in order for us to create memories, feelings, and thoughts. Alzheimer's disease causes nerve cells to die, which leads to the brain tissue loss, or what we call shrinkage, and causes loss of function and communication between cells. These changes can cause the symptoms of Alzheimer's disease, such as memory loss, problems with thinking, planning, behavioral issues, and even at the end stages, problems with swallowing.
So again, a quick recap. It was over 100 years ago that Dr. Alzheimer's described these changes in the brains, these plaques and tangles, as we refer to them as. And Alzheimer's causes these nerve cells to die, which after they die causes the brain to shrink. And this brain changes results in changes in our memory, our thinking, and even our behavior. Everyone who has a brain is at risk of developing Alzheimer's disease, and we all have a brain. Therefore, we're all at risk. But there's a few known factors that increase each of our risks of developing this disease. Let's see if we know what the most common are. Let me test your knowledge again. The greatest known risk factor for Alzheimer's is your genetics, your family history, or your age. It turns out age is the greatest risk factor. The others are risk factors, but not as great. It's not a part of normal aging. After age 65, the risk of Alzheimer's doubles every 5 years. 32% of people who are age 85 and older have Alzheimer's. I listened to a doctor the other day who said if we all lived long enough, we would probably all get Alzheimer's. Once again, we're going to hear from Dr. Snyder on this area of normal.
Alzheimer's disease is marked by specific brain changes that result in the clinical changes in individual experiences. That is, changes in memory, thinking, or reasoning. And ultimately, Alzheimer's is fatal. The exact cause for these changes is unknown, but there are some hints as to what may contribute to an individual's risk. Age is the greatest known risk factor for Alzheimer's. And when we look at populations of people, we see an increased risk over the age of 65. However, Alzheimer's is not normal aging. Family history is also a known risk factor. Research has shown that those who have a parent or a sibling with Alzheimer's are more likely to develop the disease, and that risk increases if more than one family member has Alzheimer's. When we talk about the genes involved in Alzheimer's, there are 2 categories that could potentially be involved: risk genes and deterministic genes. Risk genes increases an individual's risk for developing the disease but does not guarantee that they will develop Alzheimer's. Deterministic genes, which are rare for Alzheimer's, guarantee that the person will develop the disease.
There's also some of these populations that are much higher risk for developing disease. Hispanics are about 1.5 times as likely as Caucasians to develop Alzheimer's and other dementias. African Americans are about twice as likely to develop the disease as whites. And almost 2/3 of Americans who have the disease are women. Now, in fact, I think there's 3.4 million American women who live with that disease today. We don't understand the differences, or they're not well understood, and research is going on, but they think maybe vascular disease, the rates of vascular disease can put people at higher risk. And even though we take out the fact that women live longer than men, when we account for that, they still have higher rates of Alzheimer's disease. So hopefully our research will begin to explore genetic differences between men, women, and races to determine why this risk is different and how we would move forward. Once again, we'll have a little summary. Age, the greatest known risk for Alzheimer's. It increases dramatically after the age of 65. Family history is also a known risk factor. Having a parent or sibling with the disease will increase your risk. Risk genes and deterministic genes are two different types. Again, deterministic genes are the ones that would say you are going to get the disease. Hispanics, African Americans, and women all have an increased risk for Alzheimer's disease. As I said earlier, we're going to talk about the stages of Alzheimer's disease. No two individuals experience these symptoms or the progression of the disease in the same way. We're going to hear from another expert, Dr. James Hendricks, and exactly why is this the case, as well as we're going to have a chance to hear from some people who have been diagnosed in the early stages of Alzheimer's disease.
One of the things that impacts our brain is all the other things that can happen to us as we age. And we know that Alzheimer's, the most common risk factor for getting Alzheimer's disease is age. But we also have lots of other things that go wrong with us as we age. And so how those other health factors impact our brain can also impact how Alzheimer's presents in other people.
Let's hear from a few people who have the disease.
It's a different kind of forgetting. It really, really is. It's not just forgetting where I put my car keys. It's much deeper than that. And for example, I cannot read a book. I used to be a voracious reader because by the time I turn a page, I have forgotten what I had read. And if you're reading a novel, you have to know what transpired before in order for you to continue to read on. And so I can't read a novel. So I've even stopped trying.
Let's hear from a gentleman.
Math, I can't do a simple tip anymore. You know, I sit there, I stare at it. It's crazy what numbers I can't deal with anymore. And in some ways, that's the disease to me. The other thing that I've increasingly been struggling with are words, which I've dealt with words my entire life, you know, as an avid reader, as a reporter, as a writer. I struggle with them now.
Fortunately, we could hear him struggling right then with those words.
I'm like an overachiever and when you're unable to deliver or you're not performing at the same pace that you once did before, that's frustrating. It's frustrating to not know where you place things. It's frustrating to not be able to explain to someone the problems that you're having. You can't articulate it in a way. It's frustrating to read something and you forgot what you read. It's frustrating to continuously have to change your password and you just changed it last week and you're constantly doing the same thing over and over again.
I think the thing that surprises me the most about my dementia is that it is progressive, and I'm finding that I'm forgetting more. And they do memory tests for me all the time at the doctor, and so that becomes a little disconcerting at times to see my cognitive impairment continue to decline. But again, I really have hope. I don't live really in the future. I can't live in the future. I can't worry about what the future is going to bring. I have to live for today.
So we heard from a few people in the early stages. All their symptoms worsen over time. However, people progress through these symptoms in stages, as you will, it's certainly at different rates. On average, a person with Alzheimer's, when they're diagnosed, lives 4 to 8 years, but that's an average number. People live as long as 20 years. There's so many factors that are involved. We're going to hear from Dr. Snyder again, one of our experts, sort of about these stages.
Alzheimer's affects everyone differently. As a result, it's difficult to place a person in a specific stage of the disease. However, there are 3 general stages that are commonly referred to as early, middle, and late stage Alzheimer's. In a medical context, you may hear these stages referred to as mild, moderate, and severe. In the early stage of Alzheimer's, an individual may be able to function independently. However, they may start noticing more frequent memory lapses. Friends and family may also begin to notice difficulties in the person, and a healthcare provider may be able to detect problems in memory or concentration by conducting a detailed medical interview. Middle stage Alzheimer's is typically the longest stage and can last for many years. Damage to the brain cells can make it difficult to express thoughts and perform routine tasks, and this can lead to increased feelings of frustration and anger. In the final stage of the disease, an individual loses the ability to hold a conversation, control their movements, or respond to the environment around them. Cognitive skills, that is, their memory, thinking, and reasoning skills, continue to decline, and this can lead to personality changes and need for round-the-clock care.
As she mentioned, it's important to understand that the stages of Alzheimer's are very general, and each person who has this disease has a unique experience. We can't necessarily put a person in one stage or another. There's a lot of overlap from the symptoms from one stage to the other. But what it provides people, and especially caregivers and even patients, is just a general understanding of how the disease progresses in terms of the kinds of symptoms that you have. But again, it's different for every person, but hopefully this gives people a little bit better preparation of their future. I think we'll recap real fast. 3 stages: early, middle, and late, sometimes called mild, moderate, severe. No 2 individuals experience this the same way. And while symptoms do worsen over time, people progress at different rates as their abilities change. I want we're going to talk about approved treatments for symptoms. I think we start off with another quiz to test your knowledge. There are several drugs available to slow down the progression of Alzheimer's disease. While there are not several drugs to slow down the progression of Alzheimer's disease, the screen says there are currently no treatments to prevent, treat, or slow down Alzheimer's. However, there are several drugs available to address the symptoms. You may have seen recently in the news, I think just about a month ago, one of the major drug companies got approval from the FDA for a drug that slows down the disease. It was given its approval with a great deal of controversy. The committee who makes recommendations to the FDA said it should not be approved, but they went ahead and approved it. I think maybe because of the severity of this disease and its impact on so many people. But there's, as I say, controversial as to its effectiveness. But, you know, if it works for just some people, they felt, I think, that it was important to have that out and available and to have doctors have conversations with their patients about the appropriateness for the drug. So there is a change. It certainly, at the very least, gives us hope that we'll be able to slow down the disease and hopefully move to the next stages of prevention. We're going to hear from one of our experts. This is I believe Dr. Hendricks.
There are currently several drugs that are FDA approved to treat the cognitive symptoms associated with Alzheimer's disease. They treat the symptoms, but they don't treat the underlying cause. So eventually people will progress, but they do treat some of the symptoms and help people for a time. So the first class of drugs are called cholinesterase inhibitors. These drugs work to prevent the breakdown of acetylcholine, which is a chemical messenger found in the brain that's associated with learning and memory. There are 3 FDA-approved drugs that are in this class of drugs. There's Aricept, there's Exelon, and there's Razodine. There's another class of drugs that's modulates glutamate, which is another chemical messenger in the brain that's associated with learning and memory. And this drug is called Namenda. And then there's a final class, which is actually a combination of cholinesterase inhibitors and glutamate modulator, and this is called Namzaric.
As you can see now, these are approved and have been in use for a while to treat symptoms of the disease, but only some of the symptoms and only in some people. Again, these drugs do not affect or treat the underlying cause of the disease. 3 drugs. They each have different trade names: cholinesterase inhibitors, glutamate modulators, and then a combination of those 2 drugs. As I said, they help some people for some of their symptoms, but they don't really treat the cause of the disease. Now, how are we going to move on? How are we going to begin to get ahead on this disease? Well, we need research, and let's talk a little bit about advancing Alzheimer's research. In the last decades, and certainly even in shorter time periods, we've made tremendous strides in understanding how this disease affects the brain. We've got a lot of insights. There's a lot of new strategies and new methods and new treatments that are out there. And as I mentioned, we have one just approved, and we'll see how that plays out. But with this hope, we need a key way to keep things going, and that's through clinical studies. Scientists look for new ways to treat Alzheimer's. There's drugs in the pipeline, but we got to get and recruit people and trial participants. Let's hear from the doctor about that.
This is an incredibly exciting time in Alzheimer's and dementia research. The advancements that we've made in the last decade to understand the disease as a continuum, meaning that the biological changes are starting a decade or more before someone is experiencing the changes in the memory and thinking. This sets the stage for possible prevention. The idea that when we have the tools to identify those individuals at the earliest time point, and when we have the interventions to target individuals at that earliest time point, we can intervene to stop or slow the progression of the disease before an individual loses their memories.
I'm excited about what we're learning these days regarding lifestyle. One of those things that we've seen in the past of things like exercise and nutrition have now started to gain more momentum to indicate to us that it can change your ability to slow cognitive decline. That is really the first stages of Alzheimer's disease. This may include things like social engagement, mental cognitive training. It can be things such as exercise. It can be nutrition. All those things are now starting to point that they will lower your risk for Alzheimer's disease.
A lot of hope does come from the Alzheimer's Association, all the research that is being done. Even though there is not a cure today for the disease, I know in my heart there is going to be a cure one day. And I know we're getting closer for that cure. Because even if you fail in a research study, you learn from that failure in the research study. That failure always brings progression.
It's nice to see the association spearheading in many ways the emphasis on getting the money at the federal level and at the private sector to get the research done so that someday there will be an effective treatment, hopefully cure, hopefully prevention.
Again, great deal of help for the future. Clinical studies are key things to advancing any kind of research, but especially in this case, Alzheimer's research. Let's talk about
more important than ever for people to participate in clinical studies. The fact is, right now, we don't have an effective treatment to stop Alzheimer's disease. And if we don't have people participating in clinical trials, we never will. And so participating in a clinical study is one way that everyone can get involved in a very direct way in the fight against Alzheimer's disease. And for people who currently have dementia or Alzheimer's disease, there are some additional benefits. You get access to very close medical care. You also may be among the first people to have access to the treatments that will eventually prove to work.
Sometimes you hear the phrase, it's a failed trial. That means that it didn't hit the endpoint, it didn't achieve an FDA-approved drug. But I would say as a scientist, the only failed trial is one that doesn't give you valuable information. And if the trial is well designed, if it is a good scientific experiment, you get extremely valuable data so that you can plan the next trial and do the next study even better than the last one. And it gets you that much closer to that FDA-approved drug, to that effective treatment, and maybe someday even a cure.
Alzheimer's has a program.
Currently, more than 5 million Americans are living with Alzheimer's. By participating in clinical research, you can move us toward methods of treatment and prevention for all those affected by this devastating disease. Alzheimer's Association Trial Match is a free clinical studies matching service for those with dementia, caregivers, and healthy volunteers. To start, simply create a confidential user profile and receive a list of studies that may be a match for you. Don't just hope for a cure, help us find one.
I'm going to just stop for a moment and give you a personal note. I was very interested also in participating in this trial match to see if I could in some way help out in clinical studies as a healthy volunteer. And I was about to fill out the information on the website, and I got a card in the mail from the Cleveland Clinic, and I'm not sure why it was me, from their Brain Institute, that was asking for volunteers to take part in a clinical study that was looking at the impact of exercise on Alzheimer's disease. And I sent that card back in. I was ultimately had a conversation. I did some preliminary blood testing, and I was accepted into the program. So I'm in this clinical study to try to understand better the impacts of exercise on Alzheimer's. Trial match can find maybe many more. I'm doing it right here locally in Cleveland. I just have to visit the clinic downtown on occasions to do specific studies and tests, and everything from cognitive tests to MRI of my brain. So it's very important, if we're going to advance the research, that we get people involved, even if you're not part of the group that has the disease. Certainly we need those people too, but we need to just know how normal, healthy people are progressing through these things. Clinical studies I'm in, there's clinical trials, which often are similar, but involve somebody getting a drug of some kind, or somebody getting a placebo, or a salt water injection or a pill of some kind. So there's slight differences in them. So again, I'm making a pitch. If you have any interest at all in helping out in a completely different way, a trial match is a way you can go and participate in various ongoing studies. Quick recap of that. We've increased our understanding significantly in the past years. We need people with dementia, caregivers, healthy volunteers. We talked earlier, I said, boy, we really need people. We need women. We need people of color to be involved in these things so we can better understand and find methods of prevention, treatment, and a cure. There's drug and non-drug type trials and studies that are taking place all across the country. And trial match at our website, alz.org. Trial match is a free way to match you up with a study. A little bit about the Alzheimer's Association. I think hit this thing, you can kind of see. The association is in communities all across the country, provides direct service to individuals, families who face this disease. Our mission is to eliminate Alzheimer's disease through the advancement of research, provide enhanced care and support for everyone affected, and reduce the risk of dementia through generally promoting brain health. We have a vision of a world without Alzheimer's disease. There are a few things that are resources to you that are available to anybody. You can call the phone number, 1-800-272-3900, anytime of any day of the year. Someone is manning that helpline. And by someone, I mean someone with a master's clinician degree or higher, people who are experts in the field of dementia and Alzheimer's. Language is not a problem. You can get somebody who will speak your language. They have support for 200 languages. I didn't know there were 200 languages, to be frank with you. I had a colleague, a friend who actually used that. He had a wife who was diagnosed. She was having some behavioral issues at 3 in the morning, and he called and got a tremendous help at that hour of the night to resolve his difficulties he was having with his wife. They answer questions. They'll give you more specific things if you have, someone who's with you that has the disease or related to caregiving. You can go online, alz.org. It's a tremendous website. It's one of the best designed websites I've seen. Take your time, look around. You can get education information along with lots of other kinds of information. Find out what's going on locally. As well as if you go to that, you can put a /CRF, and that's a community resource finder. You can get some very specific information that's in our community. I think I wanted to play. I'm going to go back for a second. Here we go.
I've had a couple of phone calls that I've been able to make in to the call center. When I've had a couple of quick questions that I wanted to ask, there's been a couple of nights, 2 o'clock in the morning, you have questions, you have anxieties, and I was struggling dealing with them, and it's amazing. It was one of the best things I ever did, was keeping the call center on my favorites now. Just to know that there's somebody you can call who is aware of what you're going through.
Somebody's give you information
When
online?
I went to the Alzheimer's Association website, which is alz.org, there I was trying to find out more about what was Alzheimer's, what really is this disease, what is younger onset Alzheimer's, what is dementia, is there a cure, how long has this been around, how many people are affected by this, where can I go for resources, where can I go for help, what do I do with this? How can I handle this? Is there more people like me out there? Is there someone that I can talk to if I need to? And there I found a support line that's 24 hours a day. And there I found where I can go for workshops, where I can go and read things and postings that people have done, where I can find out what events is happening in the Alzheimer's Association, where I can see how it's affecting people around the globe.
And finally, we hear from Tom. He is also living with Alzheimer's, and he's going to talk about finding, I think, local resources.
Since I've been diagnosed with dementia, the one place that I know I can go to for assistance and help and support is to the Alzheimer's Association. There are people there that I know by name that I can contact if I'm having a difficult time, or if I'm struggling to find some resource, that they will provide that to me.
And we also have other ways you can be involved. We have a walk in October that raises money. It's where we raise some of the most money. Well, I said that research is very important. Funding for that research is very important also. And you can be a volunteer, such as I am, to do presentations like this. You can, we need people to work for advocacy, people who talk to our elected officials at the local, state, even national level, to get more money and more dollars directed towards Alzheimer's research. Trial Match, I mentioned that earlier. The Walk to End Alzheimer's, I also just mentioned, as a kind of an activity to get a little exercise and get out and raise some money.